glad that you agreed to an interview today, Dr. Thom, because the mouth is so important in overall health.
True.
And it's actually one of the areas that many people are undereducated, right? You hear people talking about what you need to do to be healthy. You got to eat healthy, you got to exercise, you got to diet. You rarely, if ever, hear somebody say you need to clean up your mouth. So Dr. Thom, give us a little bit of your story. I know that you started out just as a general dentist and how you became a biological dentist.
Yeah, well, you know, when I first started out, I just graduated from dental school and really didn't know very much. I didn't know what I didn't know, which is true with a lot of practitioners today. So it always bothered me that my patients would have all of these other issues, and the only thing I could do was do like a filling, or and at that point in time it was mercury. So then, and I just had this overwhelming feeling that nutrition had something to do with health, but I couldn't put my finger on it. So I started going, and that's what brought me to Nashville, Tennessee. Is I went to an ANA, an American Nutraceutical Association meeting, met Dr. Mark Houston, and just realized that there was a group of guys that did nutrition along with medicine. There were chiropractors, dentists, and MDs, and I thought, well, this is kind of a novelty here. And so then I got my NMD degree, and kind of because I wanted to pursue it, so I did a 3-year stint in Birmingham, Alabama, and I got my NMD degree. And then I met a lady in Minnesota, which is where I'm from, and she said, Thom, with all this stuff that you're doing, nutrition and dentistry, you should join the A4M, the American Academy of Anti-Aging Medicine. So I did. I went down, I went through there, I got boarded by the A4M and got into the anti-aging protocols and therapies. So I kind of morphed from a dentist into a nutritionist, and then into an anti-aging guy. So I'm kind of morphed out of the box.
Yeah.
And that's kind of, and it took me down here to Tennessee, and so here I am.
Well, you saw the importance of nutrition, right? Something clicked. You said, hey, that's got to be important, even though we're not told that very often.
Exactly.
Nutrition has to have something to do with the equation. Right?
Nutrition is at the source of everything. Nutrition is the key, and so and I knew that intrinsically, but I couldn't really put my finger on it. So once I got into all the nutritional therapies, with dentistry and medicine, it's the bottom line. It's what he created, and he created it for our good, and we've taken the food supply and we've messed it all up. And so what we do here is we talk about nutrition, we talk about biological dentistry, we talk about mercury detoxification, heavy metal toxicity, and how that can mess with the systems of the body, including and especially the immune system.
So, Dr. Thom, you just mentioned biological dentistry. Can you explain what's biological dentistry?
Well, that's a great question. And we say here that your mouth is the window to the rest of your body, or the doorway, if you will, because what happens here in your mouth intrinsically will affect what happens in the rest of your body. It becomes systemic. So in biological dentistry, we also call it functional or integrative dentistry. So what we're looking at is cause. We're looking at cause and effect. So instead of just filling cavities, we're looking at heavy metal toxicity. We're looking at functional orthodontics. We're looking at the growth and development of jaws. We're looking at how the TM joints work and how they operate, and we're looking at how nutrition affects the dental fluid transport system. We're looking at how nutrition affects osteoporosis in bone, and periodontitis and gingivitis. And gingivitis is just an inflammatory disease, but it can very quickly become a periodontal situation where you're losing bone. And so there's all these parameters that we have to look at, because everything that happens here becomes a chronic inflammatory situation that affects the systemic circulation, the heart, the pancreas, and into cancers.
So inflammation, you mentioned inflammation.
Correct.
Talk about inflammation as it relates to the diseases that you've seen, including cancer.
Okay. Well, you remember back in the days of essential hypertension, we talked about you have high blood pressure, it doesn't hurt, you don't feel it, you don't even know you have it, but there's something insidious about it. Well, today, we used to have the germ theory, which was one germ, one bug, one disease, one drug. And now what we have is chronic inflammation affects most all chronic degenerative disease. And we call it oral inflammation. We say it starts here. It essentially what it is there's a switch called nuclear factor kappa beta, NFKB. And I go around and I talk to dentists, I talk to physicians, and I say, how many of you guys out there understand and know what nuclear factor kappa beta is? And I usually get these blank stares. It's like, Well, what it is, it's a genetic transcription cytoplasmic switch that turns on inflammation. It's a genetic switch. So the body is so intricately and amazingly designed. It just, I don't know how anybody can look at the human body and not see a miracle, especially a little baby. Right. But what happens is inflammation is in its nascent state, it's good for us because inflammation is what causes the voltage drop and it causes healing to occur. But when we're constantly chronically inflamed and we've got this saber-toothed tiger behind our back, it ramps up the sympathetic nervous system, decreases the parasympathetic nervous system, it turns on the nuclear factor kappa beta, and it turns on all of these pathways, all of these inflammatory pathways that affect hypertension. It affects stress levels, which stress is a killer. We all know this, but it affects every organ system in your body. So you have to control inflammation, and as I said, inflammation starts here. It starts in the mouth.
Wow, that's a great connection. Another connection that we have seen over the past couple of interviews that we've done over the past couple of years is the link between root canals and cancer.
Exactly.
So could you touch on that as a biological dentist? Talk about root canals.
Well, root canals have been, there's been a lot of information and concerns about root canals. Root canals they fail quite often. They fail most of the time. And we have a problem with leaving, and it's been said that dentists are the only doctors that leave dead tissue in the body. So there's, when you do a root canal, there's the pulp tissue that you have to seal off. And when you do that, you leave the dead tooth in the mouth. So because if you want to keep your tooth in your head, you have to pretty much do a root canal, otherwise you have to extract it. But the problem is there's these dental tubules called caniculi that you can't, once you fill the root canal, they become dead space, and so then they fill up with anaerobic bacteria. So here's basically essentially what happens. You have a tooth that goes bad, and so then the voltage drops in that tooth. And when the voltage drops, then the pH drops. When the pH drops, then the oxidation goes out of the tooth and out of the area. When the oxidation drops, then the bugs come in. And the bugs come in and they set up housekeeping. Well, bugs don't have teeth, but they need to eat. They wake up and they're hungry and they want to eat. So what they do is they begin to produce all kinds of enzymes. And that they begin to liquefy you and me, and they start having us for lunch. So that begets an infection and an infective process that you cannot leave in your body, because then it crosses the gingival sulcus barrier, goes right into the cardiovascular system, goes right to the liver, produces high specific C-reactive protein and some other, that's a general inflammatory marker, and it says to your body, hey, we're chronically inflamed. We have all this inflammation, so then all of these pathways get turned on. So then what you have to do is what we've started to do is biooxidative therapies for root canals that are failed. Because sometimes root canals in the anterior segment would be okay because they're single rooted. But you leave all these dental tubules and all these caniculi that are open to bacterial infection, and you can't have bacterial infection which becomes systemic. It's a real problem.
Yeah, a real problem. Now, the solution, or one of the solutions, you mentioned biooxidative therapies. Can you explain what that means?
Yep. Biooxidative therapies is oxygen. You know, if you ask me what causes cancer, I would say, well, I'd say a couple of things, but I would say lack of iodine, and I would say lack of oxygen. And so biooxidative therapies, when we talk about oxidation is rust. When we talk about oxidation, the body, we need oxygen every day. If we can live without water for a while, we can live without food for a while, but we cannot live without oxygen for more than 3 to 5 minutes, or we're dead. So when we become oxygenated and we breathe in, then that keeps the bacteria at bay, because most bacteria that are bad, that are pathogens, or we call them pathogenic bacteria, are what we call anaerobes. Anaerobes meaning without oxygen, and they can live in areas that have no oxygen. Once you introduce an oxidative burst of oxygen into an infected area, anywhere in your body, it doesn't have to be your teeth, but anywhere in your body, what happens is you drive back the oxygen levels, and you drive off you kill oxidatively, you kill all of the anaerobes, all of the bacteria.
And when you say oxidatively, you just means you're doing it with oxygen.
With oxygen, right. We talk a lot about free radical oxidative stress, right? And free radical oxidative stress is bad. So you're saying, well, wait a minute. You're saying, so now oxidation is good? Well, when you give an oxidative burst into an area, the bacteria can't handle it and they die. Okay, and so what we do is, and we've got people that we on a daily basis, and we're going to get this machine very quickly. I'm taking a course this weekend on bioxidative therapies, but this is very commonly done in Europe and in England, Switzerland. They've been doing this for years. They're curing all kinds of diseases with bioxidative therapies. Now, our Food and Death Administration, bless their hearts, in the Tennessee way, they don't really get into therapies that really cure a lot of things, because that interrupts the monetary flow. And I'll stop right there. But you know what I'm talking about.
Exactly.
So, and I try to leave the politics out of this, but we know that there's a political component when it comes to cancer or root canals or things, or mercury toxicity, because that's a huge problem, because that affects a lot of systems in your body.
We'll talk about mercury toxicity, because thus far we've interviewed with doctors that have talked about the toxicity that are in vaccines with the thimerosal and mercury.
Thimerosal.
You talk about, you're a dentist, so you deal with the silver fillings that aren't all silver, right?
Exactly.
So could you talk about that?
Yeah, you bet. The silver fillings, you're right. They're about 40% silver. The rest is copper, tin, and mercury. 43 to 55% are mercury. Is the mercury in a silver filling? So it's a huge problem. And the question is, do they outgas? The ADA's position, the American Dental Association position, is that they do not outgas. Is that they are inert. Well, I have news for the ADA. This is not true. They do outgas, and they outgas from the time they're put in to the time they're taken out. So what we do here is we take them out in a correct way, because when you drill on an amalgam filling, that most of them have been in there 30, 40, 50 years. The problem is there's still 50% of the dentists, or I'd say 40% now, that still put mercury fillings in your mouth. So when they outgas, what happens? Mercury is a known toxin. Not a dental toxin, it's just a known toxin. It's very toxic to the neurological system, it's very toxic to the gastrointestinal system, it ties up candida, some people will call it. And so if you have a candidiasis or candida infection, or you have gut dysfunction, it's going to mess with that. It's going to be very difficult to fix your gut. It also it has an affinity for fat tissue, and since we're all fat heads, it goes to your brain. Okay, so it has a great affinity to cross the blood-brain barrier, to cross the placental barrier. That's really bad news, because that's supposed to be a sterile environment, and it causes memory loss, it causes fatigue, it causes brain fog, and we say it's an uncoupler. Mercury as an element is an uncoupler. It gets involved with coenzyme reactions, and it screws everything up. One of the biggest offenders, when you talk about mercury, you can talk about fluoride, you can talk about chlorine, you can talk about bromine, and I know Dr. Brownstein talks a lot about this, where you've got all these lesser halide molecules that will get into the tyrosine ring, which is the iodine, which is the thyroid molecule. The biggest precursor for the thyroid molecule is tyrosine. Then you have an iodine molecule, and you have a conversion factor where an iodine gets knocked off, and then you get T3, and that's your active thyroid hormone. Well, mercury messes with that. It messes with ATP production, and when you have low oxygenation, and when you have mercury binding with ATP, now instead of getting 38 molecules per ATP, or per ATP when you have a proper oxygenation and you introduce mercury, now you get 2. So you become very fatigued. Wow. And people, they come here all the time and say, I have all these symptoms, and my doctor says I'm normal. And my tests say I'm normal. Well, basically because these ranges are so big today, and they throw all of these sick people in these ranges, what they're really saying is you're normally screwed up like everybody else your age.
Yeah, that's what I was going to say. Sick has become the new normal.
Exactly. Yeah. Exactly. That's exactly.
And it's because of what? You've mentioned the poor diet. You've mentioned mercury toxicity.
Poor nutrition. All of these chemicals that we dump into the atmosphere, the mercury. But one of the biggest drivers is stress. Stress levels. Stress screws up everything.
So, Dr. Thom, you just mentioned stress, right? In the Quest for the Cures continues last year. I remember it was Dr. I think Patrick Quillen said that stress is a killer and laughter is a healer. So let's talk about the stress part of that equation.
Well, that's true. Laughter increases natural killer cells. Your basic, your immune system is what I call your Navy SEAL SWAT team. It's out there. It's detecting self or non-self. And it does it in a very efficient way. But when we introduce stress into our lives, and we get back to the chronic inflammation and the oral inflammation, stress, we're designed to handle very short bursts of stress, kind of like a sports car engine. You know, you give it a high octane gas, it runs, it does its thing, and then it shuts down. With us, stress is the same way. We're designed to, you know, our basic nervous system is designed to handle short bursts of stress, and when it's chronic, when it becomes chronic, much like chronic inflammation, well, it causes chronic inflammation. And when you're chronically, you know, you're worried about work, you're worried about what are you going to wear today, you're worried about your mother who's maybe developed cancer, you're worried about the finances, maybe your wife and you didn't have such a good night last night, you're worried about the kids, you're worried about all this stuff. We're chronically worried about things. Right. And so what that does is that taxes our immune system, and it drives our sympathetic nervous system into high gear. So what we're talking about here is the sympathetic and the parasympathetic nervous system. The sympathetic nervous system is your fight or flight. Right. That's what, you know, when somebody runs over their kid with a car, right, and they pick up the car, okay, that's right, your sympathetic nervous system. And then your parasympathetic nervous system is sleep, digestion, and just all the basic functions of life. But when we're in sympathetic overdrive, it screws up our neurotransmitters. And our neurotransmitters are brain chemicals that are produced in the gut. So, you know, if you're having depression, you know, that you got to take a look at the gut. And one of the first questions I always ask my patients is, how's your gut? And they go, right, well, you're a dentist. Why would you care about the gut?
It all goes back to the gut, doesn't it?
It all goes back to the gut. You know, digestion and disease starts in the gut. There's so numerous, millions of articles written about this. Yeah. But that's where your neurotransmitters are made. In particular, serotonin is made 90% in the gut. So if you're having issues with stress and you have gut dysfunction, and you have neurological dysfunction, it is all connected. And what I didn't understand as a young practitioner is that everything is connected. So I didn't understand the big main plan, right, like I do now. Like you know, he's put everything on this earth for nutrition, and we've taken it, like we've said before, and we've kind of messed it all up. Right. So now we've got to get away from the GMO foods. We've got to, you know, people say to me, well, it's organic. I said, well, that's great that it's organic, but is it genetically modified? Right. Because that, you were talking about the immune system, your immune system is trying to identify, is this self or is this non-self? Well, when you put all this propylene glycol, which is antifreeze, by the way, yeah, you know, into your system, and the immune system is going, well, what do we do with this? We don't recognize this as anything, and so but your liver has to deal with it. Your liver and your kidneys have to deal with an incomplete burn, an incomplete protein burn, and all these chemicals. So then we talk about the liver, we talk about cytochrome P450 system, boosting enzymes so we can detox, and all that kind of thing.
Yeah, one of the things that you just mentioned, Dr. Thom, was that everything is connected. Right.
Surely.
One of the things that we've seen over the last couple of years with the documentaries that we've done is the common thread is one of the main differences between the conventional way to treat disease, specifically cancer, and the natural way to treat cancer is that those that are doing it naturally look as the body as a whole, and the conventional, they say, okay, you got cancer of the ear, we cut your ear off. Yeah, yeah. Right? And so they look at it compartmentally, but they don't look at the body as a whole. Could you talk about that?
Sure. Well, traditionally, we look, you know, because of the way the whole medical system is set up, drug companies cannot, and they do a lot of good. I'm not going to sit here and just completely trash drug companies because they do a lot of good things. And in acute care, we do wonderful things. Yeah. But what we're looking for is the silver magic bullet for cancer. And I'm here to tell you, it ain't there. It's not there, okay? And so what we have to do is we have to look at things like glutathione, superoxide dismutase. We have to look at antioxidants. What amazes me so much is that each cell that the Lord has created has a cellular membrane that has a certain voltage and potential, and each cell is genetically prepared and designed to fix itself if we give it the right materials. And so that's why I was drawn to naturopathy, because naturopathy says if we give the body the right stuff, it's already pre-programmed to fix itself. And so we're out here over in medicine trying to figure out all of these, you know, trying to find out the cures for cancer when we know that 80% of them are lifestyle. And so if I went into the Congress and I said, hey, you guys, I have a fix. You know, let's talk about, you know, Obamacare or whatever. I have a fix that could fix 80% of chronic degenerative disease. Are you interested? And they would say, sure. And I'd say, guess what? You're not going to make any money off it. You know, but it's nutrition. It's antioxidants. It's bioxidative therapy.
The interest just went down the tube.
It's like,
at that
sorry,
point, right?
not interested.
Yeah.
Not interested. Which is a shame because really, we need to, you know, I mean, exercise, oxidation, all that kind of thing that we were talking about is really the answer for cancer.
And I'm glad you say that, because there is an answer. There are many answers,
Right.
but we're not going to find them conventionally. And the reason is that conventional medicine, when the doctors are in training, they aren't trained about these things. One of the
We're
common
not
threads,
trained in using. Here's an interesting story. And I go back, when I was in biochemistry, my first year in dental school, there was a world-class biochemist. His name was Dr. Leon Singer. Don't even know if he's still around. But he said to our class, and I'll never forget this, he says, there can be, in America, there will never be any micronutrient or macronutrient deficiencies because we have vitamin-enriched bread like Wonder Bread. And I wrote it down. I'm like, oh, cool. So there can be no micro and macronutrient deficiencies.
because it's enriched.
Yeah, it's vitamin
So
enriched.
the solution is Wonder Bread.
Never mind, it's all white bread.
Right.
You know, and it's high glycemic, and it's right spin and all that kind of stuff.
Right.
But no, it's just. But see, this we haven't really been taught.
Right.
And we've been
that's it. The doctors have not been taught. And
No,
this is
we
not
haven't.
just America. This is worldwide.
Well, they're a little more, you know, I hate to use the word progressive, but they're a little more open to bioxidative therapies and like functional orthodontics like we do here, and some of the TMJ therapies that we use here, and endodontic therapies too. And in fact, overseas they ban mercury. There's not very many countries that use mercury. We still use mercury, and I think what's going to happen there is what they're going to say, the ADA or the AMA is never going to admit that mercury is bad for your health. What they're going to do is they're going to say, we have an environmental concern. Mercury is bad for the environment, so we're not going to use mercury anymore. We're going to switch over to these other...
So that'll be their cover story.
Exactly, because they know if
Right.
they do, they're going to open up a Pandora's box, because with people with MS and autistic spectral disorders that are having trouble, understand, and they come here because, you know, not that it's cause and effect, I can't say that for the FDA, but I can tell you story after story after story of patients that have had their mercury fills removed the proper way. We put all the garb on them. We make sure that there's no vapor escaping into the, crossing the blood-brain barrier, the placental barrier, and they come back months later and we say, how are you feeling? They go, I feel a whole lot better. You know, what did we do? We just took out a toxin, and then they went and they became, and then they detoxified.
Right.
And I'm telling you, it works.
Are there ways that someone that's watching this could detoxify mercury at home? Are there natural herbs or substances that they might be able to use?
Yeah. There's a lot of foods that will increase the cytochrome P450 system, the conjugation and the bioxidative bioconjugation of the liver, because the liver is the organ system that has to upregulate and has to prepare the toxin to be removed from the body. Foods like garlic are great. Foods like cloves are really good. And I'm not a cook. Okay, I'm not a cook, but any of the broccolis, sulforaphane, any of the I'm drawing a blank, watercress, those types of
And they'll help to detoxify mercury.
they will help. Because they help upregulate the genetic switches. You get into what we call epigenetics and epigenomics, and there's a term I call dietary endocrinology. Okay. You eat specific foods, and there's a ton of them out there. There's also a lot of nutrients like transresveratrol, and if you're talking about like cardiovascular, supplementation, then you're talking about D-ribose and acetyl L-carnitine, and so I mean, our patients are very aware of these types of nutrients.
Could that be one of the reasons that a lot of mouthwashes that you see have cloves in it? I mean,
I've just met with a compounding pharmacist, and we're developing our own line. But too many of these commercial brands have all this junky stuff like sodium lauryl sulfate and propylene glycol and all these different FDA or FDC type coloring agents and this kind of thing. But when it comes to mouth rinses and mouthwashes and remineralization paste, you're talking about calcium. The real thing is What you have to do is get the mineral balance right. You have to get the phosphorus to calcium ratio, the sodium to potassium ratio. Sodium potassium ratio should be 1 to 1. It's 5 to 1 in this country. Omega-3 fatty acids, it should be 1 to 1. It's like 20 to 1 in this country. That's why we have so much inflammation. Sure. We eat a highly inflammatory diet. Almost everything we eat in the standard American diet, SAD, is very, very inflammatory.
Wow.
And it's killing us. I'm sorry, but it's killing us. And so this brings me back to another thing where I attended a seminar when I first started getting into this. And there was a nutritionist there, and he said, you guys, I have news for you. There's a battle out there, but it's not between you and your doctor. It's not between you and your insurance company. It's not between you and the hospital. It's at the grocery store. The battle is raging at the grocery store. And I thought about this for quite a while, Ty, and I said, this guy's right. He's absolutely right. And my mother taught me to go around to the outside aisles.
Right.
Well, it turns out she was right too. So there's all this ancient wisdom like oil pulling and all this stuff that people come to me and they say, well, do you know about oil pulling? Do you believe in that? I go, yeah, absolutely. You know, there's another therapy called, it's a bioxidative therapy. It's called honey. Okay, and they found this in the Egyptian tombs. And honey is a bioxidative therapy because it produces hydrogen peroxide, and you can put it on your skin and put a bandage over it, or anywhere in your body, anywhere you have a lesion, and it'll heal it with no scarring at all. And
honey.
It's honey.
Wow.
So, like I said, he's put everything here fit for our use, and we've either ignored it, or we don't know anything about it, or we've tried to develop drugs, and all drugs have side effects.
Right.
I mean, they just do it. All medications are acidic, and they all have side effects. And they all upregulate the wrong stuff and downregulate the wrong stuff. And naturopathic and nutraceutical supplementation upregulates the right enzyme systems. So does food. That's why you call it dietary endocrinology. And people say to me, well, you mean I can eat something and it'll affect my genes? Yeah. Well, how long is that? How long will that take? 2 minutes? 3 minutes? You mean I can eat foods, I can eat supplements, and that will upregulate my hormones? Yeah, absolutely. I mean, one of the best ways to control cancer is to balance your hormones. We all know this, but we try to balance it on the medical side with synthetic hormones. Well, we found out through the National Women's Study that doesn't work very well. They had to stop the study.
Bioidentical is different than synthetic,
exactly.
though.
You hang an OH molecule in the wrong place, your receptors shut down. It's called receptor site sensitivity. And it's like a lock and key. These hormones have to hit the right receptor and they have to hit it exactly. Otherwise, they upregulate or they downregulate the wrong thing.
Okay.
So, so in A4M, in anti-aging medicine, we are very big on bioidentical hormones. Okay. The rest of the medical world says, no, that doesn't matter. Synthetic or synthetic, doesn't matter. I used to argue with my wife about this. Yeah. When I first got into dentistry, she came in and said, Tom, she goes, I don't want the kids to have fluoride. I go, what? What do you mean you don't want the kids to have fluoride? I mean, to a dentist, this is heresy. It is. You're telling me I'm not supposed to give my kids fluoride? Well, it turns out she was right. She's always right. So
talk about fluoride, though. Yeah, that's a good point. They're always right.
Right.
My wife Charlene's here.
Right, Charlene?
One of the things that Dad said before he died is that when we were getting married, he said, "Remember,
yes,
your wife's always right."
Yes, sir.
And it was good advice.
Yes,
but talk about fluoride, because this is the this is the sacred cow of modern dentistry, right?
Truly, it is. Truly, it is.
So talk about that. You mentioned the fact that the choices that we make at the grocery store are killing us. Are we drinking ourselves to death with fluoride?
Well, yes, we are. Fluoride will downregulate iodine. Fluoride I'll just say this. The journal of The Lancet, a very prestigious medical journal, The Lancet, has just labeled fluoride as an excitoneurotoxin. Excito because it excites, brain chemistry, and neurotoxin because it screws up we know it's a neurotoxin. It causes cancer. It causes osteosarcoma. Kids have died from this stuff.
It is a toxic waste.
It is very much a toxic waste.
And it's they bring it in hazmat material.
Exactly. You know, I mean, it's okay for me to put mercury in somebody's mouth, but if I drop it on the floor, you break a thermometer or a fluorescent bulb, God forbid, you have to call hazmat and you have to do an environmental impact statement and study, and it's crazy.
Right.
It's ridiculousness.
Yeah. You know, I was doing a question and answer session recently, and one of the questions was about the fluorescent bulbs. There's actually on EPA.gov, there's actually a step-by-step process that you're supposed to follow if it breaks.
Exactly right.
Because it's so hazardous.
Right. But yet dentists can put it in the mouth.
Right.
Next to the blood-brain barrier, when you've got all this autism and autistic spectral disorders in these kids, that it's crazy.
It makes no sense whatsoever.
It makes no sense at all. I mean, just from a you know a thought process whereby you would just go, is that even rational? It just doesn't make sense.
It makes no sense at all. Last question for you, Dr. Thom. Been a fascinating interview thus far.
Well, thanks. And by the way, thank you for what you do. What you're doing is amazing. I mean, I got a copy of your book. Thank you very much. And I watched part of the first series, and I just think what you're doing, the world needs to hear. And I'm honored and privileged to be a part of this.
Well, the privilege goes right back at you.
I really am, my man. Thank you.
The last question.
Sure.
Children with cancer. We're seeing an epidemic of children with cancer.
Yes, we are.
What is your opinion as to why the explosion of these last couple of decades with children?
My opinion is toxins and excitotoxins and the well, let me just put it this way. They've done studies on cord blood, okay, placental cord blood, which is normally a sterile type environment. They've found over 256 toxins in cord blood coming from where? The mother. Okay, so before the baby even gets out of the womb, they are already fraught with 256 different toxins, half of which are carcinogenic. Okay, and so now you have a developing an immune system, and then we put them on Similac and we put them on Enfamil instead of breast milk, which has lactoperoxidase, which is another biooxidative therapy. Lactoperoxidase, which is in mother's milk, will break down into hydrogen peroxide. Well, we've already said that kills anaerobes, right? Okay, so that's a good thing. But what we do is we put them on high fructose corn syrup, or we put them on some type of modified corn syrup, and whenever you see modified, forget about it. We are modifying everything in our food supply, and I think it's killing our kids, and it's causing it, you know, and plus the fact that we're depleted of magnesium, we're depleted of iodine. Iodine is the big protector. It is the biggest protector of cancer, and we all have low iodine levels. If you compare Japanese studies, Japanese populations to American populations in breast cancer, you will see far more breast cancer in America than you will in Japan. And I think that transfers, you know, into our children's population. I mean, they're young, they're developing. We're giving them, like you said, shots of thimerosal for immunity instead of letting their own immune systems develop.
Right.
You know, I mean, we've done wonderful things in medicine. We really have. I don't mean to sit here and trash all that.
Sure.
We really have, especially when it comes to acute care. If you or I were in a car accident, there is no place that you'd rather be than an American trauma center.
Yep.
And having all those surgeons around, keeping you alive. I've seen it at Vanderbilt. I've seen where they've kept people alive. They do amazing stuff.
It is amazing.
But when it comes to chronic degenerative disease, which is lifestyle, we have failed as a country, and we need to turn this around. And you, my friend, are doing a great work in doing that.
Well, you are too, Dr. Thom. I appreciate all you're doing, and thank you for the time today.
All right.
God bless you.
Thank you. God bless you too.